Hi, I'm Dr. Tenner, Goldberg Tenner Clinic, where we focus on reversing chronic disease. Today I want to talk with you about prednisone, a very common drug, corticosteroid, prescribed by just about every type of medical physician, every medical specialty, from your gastroenterologist to your dermatologist to your rheumatologist to your GP. Virtually every medical physician, maybe except for psychiatrists, prescribe prednisone. The reason they prescribe it is that it'll suppress virtually any symptom. So patients having severe allergies, joint pain, skin eruptions, prednisone will usually give the patient, in most cases, quite a bit of relief. The problem is that there's a heavy price to pay when you take them, and most patients are not aware of this. The relief patients get comes by symptom suppression as opposed to actually getting healthy. It's like kicking the can down the road. Once the prednisone is discontinued, and medical physicians know they can't keep you on it long term because of the just significant potential for side effects, that once you discontinue it, your problem is very likely to come back, and in most cases worse than it was before. This is why Dr. Goldberg, who founded our clinic and still works with me here at the office, refers to it as an enjoy now because you're going to pay for it later type of approach. I tend to like to refer to it as kind of like making a deal with the devil, because you get what you want in terms of the relief now, but you're going to kind of sell your soul in the process. And so when I meet with patients, and most of them, again, are coming in with chronic inflammatory, allergic, autoimmune issues for which they're taking steroids, there's a kind of a typical speech I give them to help them understand the nature of steroids, the effects they have on the body and their physiology, and the significant risk they're being put at for major side effects. And so I'm going to show you, I'm going to take you over to the board here where I've got a graph. I'd like to explain this to you. Most patients do not understand the concepts I'm about to share. It's a very important thing to understand so that you know what you're getting yourself into when your doctor offers you corticosteroids, including prednisone. Okay, so when you take prednisone, it's important to understand that what you are taking is a synthetic version of cortisol. Cortisol is the body's natural steroid hormone produced by your adrenal glands, the two little glands that sit on top of your kidneys. Cortisol is a very important regulatory hormone. It's involved with the stress response. And so when you get under stress, the body will kick out more cortisol. It's also involved with blood sugar regulation. It helps to control inflammation. It can affect a person's weight and their energy production. So it's a very important hormone involved in a lot of areas of your physiology. A normal cortisol pattern secreted by the adrenal glands over the course of a day is shown here as the green line on the graph. People normally produce cortisol in higher amounts in the morning and lowering amounts throughout the rest of the day. So this line here on the graph is the normal pattern. So here on the x-axis you have morning, noon, p.m., midnight. Y-axis you have cortisol. And again, more cortisol is produced in the morning and less as the day goes on. That is the normal pattern of cortisol secretion. Over the course of an entire day, the body will produce approximately 25 to 30 milligrams of cortisol during that time. That is the normal pattern of production for good health. Now, when a patient takes prednisone, what they're taking is a synthetic version of cortisol. Prednisone is 5 times stronger than the natural hormone. So when a patient takes prednisone, they're taking cortisol, but in much larger amounts than what the body would normally produce. We've seen patients come in that are taking 20, 30, 40, 50, 60 or more milligrams of prednisone. To get the equivalent in cortisol, you have to multiply that by 5. So let's say for math purposes, a patient's taking 25 milligrams of prednisone a day. Okay. To get the equivalent, you'd have to multiply that by 5. So 25 times 5 is 125 milligrams of cortisol, the equivalent in cortisol. Again, the body would normally only produce about 25 to 30 over the course of a whole day under normal circumstances. That's a physiological amount. When you take 25 milligrams of prednisone, you're getting the equivalent of 125 milligrams, which is 5 times the amount of cortisol that you normally have circulating in your body over a whole day. So if a patient takes 50, then they're taking 50 times 5, which is 10 times the amount of cortisol that would be circulating over the course of a day. So if you take a hormone in the body and you jack it up 5 times, 10 times, 15 times, you can imagine what type of adverse effects would come of that when you disturb physiology that significantly. Imagine taking a woman and jacking up her level of testosterone by 5, 10, 15 times the normal level, or a man increasing his estrogen level 5, 10, 15 times the normal level. What kind of side effects that would produce? That's why when you look at the side effects of prednisone, you just go online and do a basic Google search. You'll see the list is about a mile long, from diabetes to cataracts to thinning of the skin to osteoporosis to mental psychosis to weight gain. And we've seen just about all these side effects with the patients that come to work with us, because most of them have taken prednisone or have been on prednisone repeatedly in the past. And their health has been significantly affected as a result of it. All right, so when a patient takes prednisone, again, this is what the line's going to look like on the graph here. In fact, this doesn't even accurately represent the graph. It's just about as high as the graph goes, that the level of cortisol is going to be so high in comparison to physiological doses. And again, you're going to have much more circulating cortisol than you normally have under normal circumstances at any time. After a prednisone patient has stopped taking prednisone, what you usually see is a big deficiency of cortisol production, because when you take a hormone exogenously, the gland that produces it, the adrenal glands, their function has basically been turned off as a result of that. It's been suppressed because you're taking a replacement therapy. Whenever you take a hormone in doses larger than normal amounts, the gland that produces it basically just shuts off. So that's one of the other major risk factors of prednisone use, is adrenal suppression. The glands will have gotten very weak. When you get off prednisone, the body's going to have a hard time kicking back in. And what we normally see when we test cortisol after a patient's been on prednisone for an extended period, is we'll see a low level because the adrenal glands have been significantly weakened as a result of that. So again, these are problems that can occur as a result of the use of a drug that significantly disturbs physiology. Now, can patients overcome this? Yes, we have seen many patients who have come in who have been dependent on steroids, who have taken them long-term, who have had problems as a result, including the initial problem they had that they came in with, whether it was rheumatoid disease or dermatitis or colitis or Crohn's disease. Patients can be helped and they can recover. But this is a very delicate situation, and the specific things that you need to do with each case, depending on the circumstances, to help rehabilitate their adrenal glands and improve their function. In addition, whatever the original problem they had, whether it's, again, rheumatoid disease, MS, colitis, Crohn's disease, the underlying factors that led to that problem in the first place need to be identified and addressed for that patient to have the ability to recover. That's what we do here at the clinic, and working with people to help recover and improve from chronic health problems and reverse their problems, not treat or suppress their symptoms with drugs like prednisone, but rather to identify the causes of their problems, address them directly, rebuild health, and recreate the body. And when we're successful in doing that, we watch people with all kinds of problems get well, be less dependent on drugs, and not be on repeated rounds of steroids. So if you enjoyed this video and found it of value, please hit that subscribe button for more educational content. You can also visit our website at goldbergtenorclinic.com, where we have more information about our approach and our services in helping patients reverse chronic disease. We present numerous case studies and video interviews with patients, before and after pictures and before and after lab work, illustrating the good outcomes that are possible. There is hope for patients with chronic health problems to regain their health and reverse their disease.